Moving on to our next panel discussion on the impact of digital transformation in health system management, we will discuss opportunities, challenges, and future pathways. Our esteemed panelists are Ms. Anahit Avanesyan, Minister of Health at the Republic of Armenia, Dr. Siddhartha Datta, the World Health Organization representative in Armenia, Mr. Tigran Chorokhyan, Innovation and SDG Finance Portfolio Manager at UNDP Armenia, Mr. Jerry Gevers, Head of Digitalization at Ion Beam Applications, IBA, Mr. Shant Sheherdimian, Associate Professor of Surgery at the University of California, will moderate this discussion.
Good afternoon, everyone, and thank you for joining us for this panel on digital transformation in healthcare. Digital transformation in healthcare is well underway, but I think most of us would agree that we've only seen the tip of the iceberg in terms of what the future holds. I'd like to start off by asking the first question to Gary and asking him to envision what healthcare would look like in 20 or 25 years from now. As a surgeon, will I even still have a job?
Good question. Well, thank you. Well, yes, I'm sure that surgeon will still have a job in 20 years from now, probably assisted by few tools that you will have. First, to prepare your surgery and engage with your patient. As a matter of fact, I met last month, there's this company called Avatar.io, and they're helping the surgeon to engage with the patient with 3D images so that the patient can see what will happen. And this is the phase of surgery. And there's another support that is given by this company, for example. They are able to help you to define from which direction in the body you will be able to come with tools so that you minimize the risk for organ that shouldn't need surgery, of course. So that's kind of tools that you will have. And during the surgery as well, you might have some, we discussed extensively with the Professor Max the power of images, and you might have some, images where you are under the surgery, helping you with biomarkers to see where you need to cut or where is the tumor exactly, with the difficulty to have, from just the eyes, some tumor contour very exactly. So that's kind of things. It's called personalized medicine, and you will be probably helped with these tools in the years coming on.
Personalized medicine has a P in front of it. I know that there are the 4 Ps in the digital transformation of healthcare. Maybe this is a good time for us to discuss what those 4 Ps are.
Yeah, indeed. The AI technologies can bring a lot of value throughout the life cycle of a humankind. And we believe that, healthcare start with the health and not sick care. So prevention is very important, and the data we saw again this morning with the genome, the microbiome, the sociome, and all the oome, you name it, you can identify population at risk for some disease. And proactivity healthcare is also the second parameter where technology can bring value. To detect cancer at the early stage, or disease, or Alzheimer's disease at the early stage, can be done with technology. And if you can treat today, I'm active in nuclear beam to target cancers. The more you can detect the cancer at the early stage, when the tumor is only 1 millimeter size, the better for survival rate. And so on the proactiveness of healthcare, then I believe that the data can come. And the fourth pillar where the technology can bring value is the participative healthcare, where each of us have a set of data, and we can engage in the healthcare system as a human being, and be able to report on some parameters of our body, on our mind as well, to detect if the outcome of a surgery or any curing can be complemented by the next, I don't know, the next curing phase or the next diagnostic phase. So participative, but beforehand, prevention, proactiveness, and then personalized care. That's the formula.
Yeah. So all of this is very, very exciting, but I think the 4 Ps allude to the fact that we as clinicians don't work in silos, and for us as a population, we, besides just consuming healthcare, we live under the ecosystem of a health system. Minister Avanesian, on a daily basis, you make some very difficult and complex decisions, sometimes with little data, sometimes with too much data, and sometimes with not good data, and always with uncertainty. How have you seen digital technologies help you with this complex decision making, and where would you love to see more help come from these technologies?
Thank you, but first of all, I understood from the colleague that you will have a job, but it will not be the same one as Hoshant. You need to have, always change your competencies, so you remain in your position. But yes, we see that, and during these 2 days also heard a lot that in drug design, in diagnosis, in surgery, technologies are becoming a very important part of the solutions. And we can say that also the management of health systems and also policy design is not something isolated. If we do not embrace these technologies, AI solutions in policy making, we will have the same constraints that we had for years. It's time, accuracy, and the possibility to see how your policies are going to affect and what type of outcomes are you going to have when you apply the solutions, when you design some new way of conducting the healthcare. So it's important to understand that when the government is changing, you have only 4 or 5 years to design some new policies, to implement them, monitor, and then to have some tangible outcomes. So I believe that we need to learn and more invest in our ability to find how can AI, and today also we have some parts of it in our daily routine work, but how we can have better solutions and tools to know precisely what the health conditions of our nation, the real time, not the data that was archivized, but the real-time data, and to see what are the solutions in the world. So it's also important to have very working tools to have comparison. What works where and how it works, so we can adapt these policies, these new ideas in our countries. Then monitor them, to have tools to see, and not only when the policies are already in the process of in life, but as we say, in vitro. We can see that you change something, how it can affect and see it on a big data, and to redesign or reshape your understanding and be more precise and have better outcomes. I believe that we need to learn all the time in order to go with the time, to have this possibility of and power to have decisions, because it's also important. So in 10 years, who is going to be the decision maker overall? The algorithms, the data, who makes the input, who sees the output? So this is very important. We, as a policymakers, we need to define for ourselves that we need to keep the power of decision and to have this humanity in the center.
Great. So good data, real-time data, and the ability to apply that data so that we can make the best evidence-based policies for the population. So that's a big task. But Diganjan, I wanted to see if you had any thoughts of how we can implement and assist governments and policymakers so that they can actually apply all of these technologies?
Yeah, thank you for the question, and the panelists to elaborate on more on something that I would like to talk about. And the minister has touched upon different aspects of innovation and data-driven decision-making. Of course, it's self-evident that leveraging digital data and technologies will lead to better healthcare outcomes, and on the policy and institutional level as well, bringing more transparency, inclusiveness to the decision-making processes, and to enhance the service delivery for the patients, for the citizens, and especially in the healthcare sector. And according to one of the researchers of Deloitte, the AI-driven automation can decrease the administrative delays in the healthcare sector by up to 70%, which is a remarkable amount of, a burden that is put on the shoulders of the citizens and on the government as well. That's something that digital data and technologies can solve themselves. And UNDP, of course, is one of the biggest development agencies in the world that is supporting the governments to get rid of those red tape of bureaucracy, including with the, harnessing the potential of digital technologies and digital transformation as a whole. Armenia's office is not an exception, and even more on a positive note, I would like to state that we have one of the biggest and strongest innovation teams in the world, which has been praised by one of the reports, the report of the UNDP's evaluation, stating featuring the Armenia's SDG Innovation Lab as a role model for next generation innovation labs throughout the world, with its capacity and innovative approaches of human-centered design and implementation of policies. And we have a lot of examples that the Ministry of Healthcare in Armenia has pioneered as a champion ministry to absorb those innovative approaches and initiatives that we have implemented in Armenia, such as the Revive Acceleration Program, which supported the growth stage startups to develop and refine their assistive technologies to aid the veterans, and UNDP has even supported them to participate in different contests and win the first and second prizes, like in 7 Startup Summit. We have supported the ministry to make the decisions more evidence-based and the services more personalized for the citizens, especially I'm talking about the Barev Balik platform for providing personalized services and information to mothers-to-be, parents of children, and those couples planning a family in the upcoming years. Another flagship initiative that we have implemented in Armenia with the Ministry of Healthcare was the AI for Mulberry, which is an AI-driven tool that automates categorization of citizens' requests addressed to the government, and it channels the request to the certain departments based on analysis of over 120,000 letters, historical letters, to learn the paths from. But again, here comes the main question. Those are fragmented and standalone initiatives. How do we make sure that those initiatives bring up systemic change at the end? And I would like here to reverse the discourse around not what the digital technologies bring, how much they bring benefit for the decision making, but rather what is the systemic enabling environment that ensures the harnessing and unlocking the full potential of digital technologies and digital transformation. And recently, to explore this idea, we have partnered with the OECD. It's the biggest, one of the biggest organizations of the developed countries. More than 40 countries are part of it. We have brought OECD together with the Swiss Development Agency to Armenia to implement an assessment of innovative capacity of the government, the public sector as a whole, to identify the main bottlenecks that hinders the absorption of digital technologies and digital transformation in Armenia. So I'd like to spice up the discussion with a few figures. Like one of them, of course, it found out that, and it articulates that digital technologies are one of the strongest drivers for innovation in any country, including in Armenia. But on the other hand, it has revealed that just one simple input, digital upskilling, upskilling on evidence, data, and digital technologies among public servants will increase the likelihood of innovation by 45%. I mean, small input, huge outcome. And still, we need to overcome this challenge. Another challenge, more than 40% of respondents, and in mainly the middle-level managers, and which are surprising to us, have indicated that they are doing innovation in their everyday work. I mean, of course, this was surprising to us. But on the other hand, the research found out that though the motivation for innovation is predominantly intrinsic, so they find it personally rewarding to innovate rather than the system encourages innovation in their everyday work. But just the opposite. They just revealed that the current mechanisms, extrinsic factors such as promotion, salary increase, the awards, recognition, etc., they discourage innovation by 16%. So we not only have a system that encourages, but we have a system that discourages innovation. I mean, I'm talking about overall the system, and it's not inherent to the healthcare sector. But as I mentioned, overall the healthcare management system is one of the most advanced ones among the public sector as a whole. So another systemic factor that I would like to bring into your attention is the research indicates that one of the main drivers for innovation is the safe space for experimentation, the tolerance to risk-taking, for testing, prototyping, iterating, learning, failing, and learning again until we succeed, and collaboration. This is what I mean. These are one of the main groups of drivers that still enables innovation in the public sector. But again, here we have another struggle. The research indicates that the current collaboration mechanisms in Armenian public sector are too formalized and enable more a senior level decision maker to make the decision, top-down decision, rather than encourages bottom-up approach of participation and grassroots decision-making from the bottom. And again, it discouraged innovation by 30%. This is another bottleneck that we need to solve. And here comes the basic institutional capacity thing that we need to still develop in Armenian public sector to enable the harnessing, this unlocking the potential of digital technologies. And here comes one of the main problems that we face. This is the huge gap between the strategy intent and the capacity to implement what we have committed in the strategies. And again, here comes the main outcome and takeaway. In order to have the digital transformation in place and with its maximum potential implemented, we need to change the public sector system and structure so that it enables absorbing and implementing digital transformation and innovative projects and initiatives in Armenia. I mean, this is the main takeaway I would like to talk about. And there are many other reports indicating that this is the most recent one. And to be honest, the findings and the report hasn't been released, so please be very diligent in popularizing those figures that I have provided. Still, the report should be released at the end of this month officially, and you will most probably hear about that. Thanks.
Great, thank you. So really maximizing the potential of digital technologies in healthcare excites every single one of us, whether as clinicians or as the citizenry at large. But Dr. Dada, this is healthcare. People's lives depend on these technologies working well, working equitably, and there are undoubtedly already and emerging challenges to implementation of these, both at the bedside as well as on the policy level. As someone who represents an international organization, the World Health Organization, what are some of the initiatives or ideas about how to ameliorate or minimize these challenges moving forward, specifically looking at the barriers to digital adoption, obviously data privacy, cybersecurity, but also barriers to developing resiliency in health systems. How are we going to overcome these challenges?
Yeah, thank you so much for that question. It's pretty broad, Shan, so I will try to break it up a bit.
Okay.
But I think before we even go to the challenges, I would say talking about transformation in digital health is empowerment. This empowerment starts at the policy level, we heard from the minister, but we also is empowerment of the individual at the community level. And this is what is a central part of what WHO says, transformation of digital health. Tools are only one part of it, but that goes much broader around when we talk about digital health transformation. Armenia, we are seeing such a good example. I think we appreciate, Minister, taking that we need to learn, but we also need to just take a pause and say how far Armenia has gone through, but how much we can learn from other countries. Governance of digital health is a central pillar. You talked about data privacy, you talked about data security, we should also talk about digital literacy, which is a critical component of all of us. And that is what, from WHO, we feel is an architecture around the digital health, need a cooperation and collaboration from everybody, some people in the country, but also outside the country. The other part is, when we talk about this empowerment and digital health and its transformation, we had been engaged with the Ministry of Health to do a sort of a scanning overview of the cybersecurity issues in Armenia. Just to give an example, because this shows a forward-looking vision of Armenia to look for avenues where they can strengthen. And, but this is also bringing the point, as UNDP has shared so many examples. One of the principal elements within the data action plan, which was agreed by all 53 member states of WHO, including Armenia, was to have what we say a fit-for-purpose digital health. We can learn, we can listen, we can go and check, but Armenia knows best what needs to be done, but also let us slice it back again. What will happen in one of the MARSes may need some sort of a specific tuning before you go and scale it up in the countries. When we talk about artificial intelligence or artificial intelligence derived systems that we had been talking in this conference and since morning, we all need to also realize that digital transformation is happening at this point of time. It's not in future. If you go out in the streets, people use wearable devices. If you talk about healthcare, we are talking about telemedicine. We are talking about mobile health, telehealth. And these are some of the avenues where the population has gone quite ahead. And these are, we talk about personalized treatment plans, yes, sure. But we also need to understand that within these new innovations that have been brought in Armenia and other countries as well, are we doing sort of an evaluation and monitoring? What worked, what did not work? And I think we want to bring in a thing here that when we talk about empowerment in digital health, transparency and sharing of these practices are immense. Because when we talk about data privacy, breach of data integrity, the trust of the population on the healthcare system will decrease. And we just cannot afford it. Because digital health is a sort of a complementing to what the policy level planners are trying to make. What are these? This is to make health services accessible. Telemedicine is a great example. In remote, hard-to-reach areas, patients need not have to travel to the healthcare center or to the national capital. They can get a consultation way back from there. Think about aging health workforce. These digital solutions will be complementing but also facilitating access and ensuring equity in health services. While these things are being done by the policy planners, integrity and data privacy will still become and remain the centrality part. We should not be scared. We should be aware that these are the things that other countries have stumbled, they have fought for it, and I think the GDPR policy of the European Union is still one of the strongest data privacy things that we can all learn on. I think the integrity, just to summarize, would be we should not be worried, but if there are concerns, we should be able to answer that for the patient, the people who are finally the beneficiary of this system.
Thank you very much. It seems that all of the panelists have viewed digital technologies as a tool to improve care, and maybe unlike other sectors where people view the technologies as a replacement, here we're really seeing the technologies as a supplement so that the clinicians, the policymakers are able to work more effectively, efficiently, and not be replaced by the technologies. I wanted to come back to you, Gary, and ask, we know that the provision of medical care has changed because of the technologies. What about the caring aspect of medicine, of healthcare, the empathy, the emotional aspects that the system and the providers provide to the patients? Is there a role for technologies in this sector of healthcare?
Well, indeed, empathy was one word, a key word said yesterday during the talk, and indeed the tools are not able to replace human. I wanted to add that healthcare is not, of course, we are not only body, we are soul and mind as well, and the healthcare should be taken as a, as an holistic approach. I don't know if the tools that we have will be able to help us on that. I think we should be all concerned by the fact that the tools is not a solution. It's giving inputs, sometimes wrong inputs. We know hallucinations. We know how it is difficult to have a correct data. But the final decision, the clinical decision, and the way we approach a human being is, for me, will stay human. I don't believe in, although I believe in a lot of tools and support to help on effectiveness of healthcare, I don't believe that we will be able to have a generic AI who will help us to take decision, replace us. Yeah.
Great. So job security for us all.
Yeah.
Okay. Maybe if I can ask all of the panelists to wrap up their, summarize sort of their thoughts about the future of healthcare, health systems, where they, what they can dream of with regards to healthcare in the upcoming 20 or 30 years, and maybe we can start with the minister.
Of course, I dream that these technologies, AI and digital tools, they will not create more inequalities, but help us to decrease the inequalities in healthcare. So this is very important because, yes, technology is very important, but if you don't have the access, if you are not digitally literate to use these technologies, it means that your community is somehow becoming out of the development. So from the policy-making perspective, for us it's important that we do everything, that these new solutions bring more accessible healthcare to our citizens. And for this, it's important to invest and work on digital literacy. So sometimes we have the best solutions, but people need to know how to use these solutions. People should know how to make the inputs correctly, to create the good data, not overload the system with data that no one needs. So we should invest in educating not only children who are going to become professionals in 5-10 years, but professionals who work now. So our doctors, nurses. So from my perspective, I emphasize this element so much. And of course, the new innovation should be in line with the needs of communities and people. So sometimes there are very interesting, very, posh solutions. Yeah, exciting solutions. But we need something sometimes more simple things to be done in order to meet our today's need. So from our perspective, it's important to give the innovators the right needs to work on. I was in UNGA, so one of the topics was the AMR. So antimicrobial resistance, which is going to be one of the biggest challenges in healthcare. But we see that not as much innovation in this field is done now, but we policymakers need to emphasize to initiate the innovation in the fields that we need, not that it's going very nice to have very, very pretty, I don't know, tool, but something that helps today and will help in 10 years to have healthier societies. And of course, prevention. And these tools make people as stakeholders, as managers of their health. They can use AI, they can use very important tools. We all use phones all the time, but for what? And prevention is something that these tools can be a part of solution.
Thank you very much. Anything to add, Dr. Dada?
Yeah, I think one of the things I want to add on to the the aspect that has been laid out is we need to keep the evidence informed as a central pillar of whatever we are talking about the digital health. Number one, I think we need to know what evidence is there out there in the digital ecosystem, of understanding what worked and what did not work. As startups will come up in Armenia and other countries, they also need to just look through how other organizations, entities have failed. Those are learning, not a failure. Because I think the other countries which are going through need not have to go through the same pain points which they have underlined. And the other part is we need to be very open in doing evaluations and monitoring as an integral part of innovations happening, because that is how we can build on a fit-for-purpose system, both for the policy planners, but also for the population, which is the beneficiary. And the other part is, if at any point of time, our digital solutions are not patient-centered, are not designed to reduce inequities and accessibility to the healthcare system, then I think we need to then come back and then see within the broader concept of healthcare management, where does that digital solution align itself with? We should not be hesitant in taking pause and reviewing, but we also should not be too slow in moving forward. Because the digital world, whether we like it or we don't like it, the population has gone ahead with. And I think it's a sort of catching the train which has already left the station, but we can make sure that the train reaches the right station to which we as policy planners and collaborators can design our digital health with. So that's how I would put it across.
Thank you very much. I think we're coming near the end of our session. So if I can just summarize, we started the discussion or this panel with the 4 Ps. When I heard the concluding remarks, I heard 4 Es. And those were equity, to make sure that the technologies are equitably distributed to the population. Empathy, to recognize that healthcare is, there is the empathy component to all of this that is going to be difficult to replace with technologies. Education, to make sure that the issues that have to do with digital literacy are addressed. And finally, use of evidence and evaluation to make sure that technologies are being appropriately implemented. So if that accurately sums things up, I would like to offer a round of applause to our panelists and thank them for their presence, and we'll conclude the discussion.
Okay. Thank you so much for sharing your insights on such an important topic. We hope to see AI developing the medical sector by all means possible in the near future.